heart disease is the leading cause of death for both men and for women. It claims more than 1 million lives every year. Medication or even surgery is often the prescribed treatment. But some doctors say there are other options. And joining us today is Dr. Fred Harvey. He is from the Harvey Center for Integrative Medicine. Thank you so much for coming today.
Thank you for having me.
We are so excited to hear about those other options besides medication or surgery.
Well, I'm glad to tell you about it. My practice is a little different from most medical practices in that rather than functional medicine looks at function, not disease. Mm-hmm. And we try to look at the human being and lift up their function overall rather than just trying to target the disease. Mm-hmm. Western medicine is where I'm trained, and I understand that disease-based system where we name a disease, blame a disease, and then try to tame it with drugs, surgery, or something else. And it works in acute care. But functional medicine looks at the long picture and tries to uplift the human being so that the disease processes that burden us sort of fall away. You know, if the systems are working well together, then we don't tend to get burdened with the signs of heart disease, for example. Cholesterol is a sign of heart disease. It is not the cause of heart disease.
Oh, I see.
And so we look deeper than, why did we get high cholesterol and try to fix that problem.
So what would you do for cholesterol?
Well, for heart disease overall, I look at how the person's living, because functional medicine goes back to basics. And there's another thing about functional medicine in that we are very participatory. The patient really needs to buy into the paradigm, because it's not a pill for every ill.
Oh, I like how you said that. So you're thinking more of lifestyle changes. So
Exactly.
maybe exercise, eating differently, and then coming up with a better plan to lower your cholesterol.
It gives you control over it.
Exactly, and that's the difference also. In functional medicine, we look at the individual, whereas in Western medicine, we use epidemiologic statistics and say, okay, well, this person, this group of people has high cholesterol, it looks like they have more heart attacks, and this drug drops cholesterol, it looks like it drops heart attacks. So we look at it on a very linear basis, whereas I look at a person who has obesity, sedentary behavior, too much sugar, too much alcohol, and too much smoke in their diet, essentially.
That's all the biggies.
The Greeks looked at the whole big thing. Dieta is how we live, not just what we ate. And so all those things come into it. We need to buy into that understanding.
All right,
That's how we lift
let's
this
go a
up.
little bit more into treatment plans.
Sure.
Tell us about that.
Well, when we go into treatment, I use a lot of lifestyle. So we have to get people moving. If they can't move, there's a great therapy called chelation therapy. And it acts like a passive exercise, sort of. It helps to dilate your blood vessels, just like you're exercising. It gets blood flow down into the tissues really deeply and helps you move out the toxins and energize those tissues so they work better. The real cause for heart disease is injury to the blood vessel lining. And the cholesterol is spackle on that injury. If we keep injuring it, we keep spackling it, we keep making more cholesterol. But if we stop the process, then we probably don't even need a statin drug at some point because we don't have any more of that injury going on.
So if chelation therapy, am I physically moving, or are you moving things within me?
Moving within you using chemicals. We use a combination of vitamins, minerals, and a chemical called EDTA, which binds up to lead and iron and even calcium and shifts the way the body metabolizes. So it really energizes while you're sitting there for 3 hours in the chair. And there's actually proof that this works. The trial to assess chelation therapy was published in 2013, and it showed that there's actually a lower progression onto bypass surgery. And it's really great. It's amazing.
You had mentioned earlier that you help prevent the second heart attack.
Yes, and so that's what chelation therapy is about, because there's a new trial starting, and my center is going to be enrolling people in this trial for diabetics that have had a heart attack. And they are the ones that have the biggest impact with chelation therapy. If we can get them doing chelation therapy and lifestyle changes, we can stop the process and maybe prevent that bypass surgery.
That is amazing, because you were saying earlier, 1 in 3 women die of heart disease?
Yeah, and only 1 in 30 die of breast cancer. So I think women really need to be aware that heart disease is big. And they really need to pay attention to that part of health.
Too.
Silent until it happens.
Now, you've got an event coming up. Tell me about that.
In 2 weeks on
October
Wednesday.
19th.
You got it, ladies. I'm going to be speaking at Wild Ginger Apothecary. Invite everybody to come. The more people, the merrier. We basically provide answers for really good questions and have a lot of fun interacting.
A lot of people around here have a lot of questions we'd like to get answered. That would be great. Thank you so much. And HarveyCenter.com, you can get more information and find out more answers to these questions. Thank you so much.
Thank you.